Hello, very good morning to all of you. Today we are going to see the case now of Mrs. COCO Thompson. She's a 71-year-old elderly female admitted to the gastroenterology department. So this patient, so what she needs is there in the writing task. Let's go ahead to see the writing task. You can see the writing task using the information in the case notes. Write a letter to uh, Dr. Thomas Brown, the patient's general physician. Actually, it is not a Mr. Thomas Brown, it's Dr. Thomas Brown. There's a small mistake there. The patient's general physician in Woodland Street, Alabama, for regular monitoring of medication complaints and BP. So this is the thing. So we need to understand this patient is known to the doctor. That's Dr. Thomas Brown knows who the patient is, Mrs. COCO Thompson, who she is and what her condition was and what her history was. All these things is known to Dr. Thomas Brown. Now, we are requesting Dr. Brown to monitor her medication complaints and blood pressure regularly. This is the task here. Now, let us go ahead with the task there. So we have the patient name as Mrs. COCO Thompson, and date of birth is 5 of March 1951. So these two. So we don't have to see the social background. We don't have to see the medical background because these things and the regular medication, family history. Up to this point, we don't need because this is Dr. Brown is Mrs. Thompson's general practitioner. He knows all these things, and these things should be excluded from the case note once you write the letter. Now, on 7th of January, that's way we have to start with. We have allows discoloration of skin, swelling in both legs, and main thing. So we have appetite decreased. So I just need to select 2 or 3 things from here. I don't need to go ahead with the vitals. I can say the vitals are abnormal. If you want, you can say that blood tests were done, and we have elevated SGOT and SGPT level. So that's something which is determining the diagnosis, that is alcoholic liver disease. So we have a USG abdomen, and we have seen that there is fatty liver from USG abdomen, and we have the SGOT, SGPT increased, so that confirmed the diagnosis. So we don't have to write all the pathological investigations and results. You just need to see 3 things here: SGOT, SGPT, and the USG abdomen. So this is what we have to see here. Now, we have the plan here. Plan is pentoxifylline, vitamin K, thiamine, hepa, rifaximin, furosemide, lactulose. So these are the drug therapy that we have prescribed from the hospital. And this has to be continued once she is discharged back to Dr. Brown's care. So these things are to be seen very seriously and has to be written with a name, the dosage, and the frequency as it is. And this should be handed over to Dr. Brown, and we need to ask him to maintain this compliance once she is discharged till her review after 2 weeks. So this is what, along with that, she is having hypertension that Dr. Brown knows, and this has to be monitored along with the medication complaints. So now what we have during hospitalization, we do have the progress. We have reduced the liver injury. We have improved signs and symptoms. The quality of life of the patient has improved, but still we have some of the withdrawal symptoms. We can see tremors, anxiety, fatigue, and sweating. And that was managed, that is supposed to be managed with the lorazepam. So this is a plan here. So what we have to do after the discharge is that you have to have a complete abstinence of alcohol, and nutritional food should be given. That physical exercises, medication compliances, appointment, patient education, and motivation, all these things are to be included in the discharge plan. So we have seen what we can include and what we can exclude. Now we can see the date, that's today's date, that's 10 January. Dr. Thomas Brown, patient's general physician. So we can say patient apostrophe, yes. I go with a small change here. General physician of Mrs. Thompson. Okay. Woodland Street, Alabama. Dear Dr. Brown, Mrs. COCO Thompson, date of birth 5 March 1951. I'm writing to update the current health condition of Mrs. COCO Thompson, who has been diagnosed with alcoholic liver disease. She requires strict medication complaints and regular monitoring of her blood pressure following her discharge. So as we have already mentioned that the patient, this is the patient's general physician. We don't need to say that here in the purpose. Now, Mrs. Thompson had yellowish discoloration of skin, swollen lower limbs, and decreased appetite at the time of admission. So these were the complaints we have seen at the time of admission. A diagnostic ultrasound abdomen revealed fatty liver, and further blood investigation showed elevated SGOT and SGPT, which helped to confirm her diagnosis. Okay, so I can minimize this thing, which confirmed her diagnosis. Therefore, she was prescribed with the following drugs: pentoxifylline 400 mg and lactulose 200 ml TID, injection HEPA, in MERS, rifaximin, all these things. These are the following drugs. So she was prescribed with the following drugs. These drugs are there as per the frequency: thrice a day, twice a day, and once a day. Today, you can see that it's first we have 2 drugs thrice a day. Next, we have 1, 2, 3 drugs twice a day. Another 2 drugs once a day. So that's as per the frequency it is ordered. It's not as per the seriousness of these drugs. It's classified based on the frequency. Today, during assessment, Mrs. Thompson's general condition was seen improved. However, she still has some withdrawal symptoms for which she was prescribed with lorazepam or zero point 0.5 mg Saturn frequency isolated. So this is a separate sentence. Why is this a separate sentence? Is the progress and the further progress is assessed. Modification is also made there. Now we have to make the request in addition to the assistance in medication complaints and BP monitoring, please maintain alcohol abstinence and follow and focus on healthy nutritional requirements once Mrs. Thompson is discharged. Kindly encourage mild activities. Yeah. Kindly motivate her. I think the word is missing. Yes, kindly motivate her and encourage, motivate and encourage her, and encourage her to, oh, sorry, kindly motivate, kindly provide her motivation and encourage her to perform mild physical activities. Okay. Now it would be worthy if you could remind her that she has a follow-up in 2 weeks' time. Just made this thing a little bit formal. Please do not hesitate to contact for any further queries. Yours sincerely, nurse. So that is the end of the explanation. Have a nice day. Thank you.